researchers. I start to go to conferences, and still the doubts of the university doubts, they were there in some place inside me. When I start to visit the conference, I start to talk with doctors and patients, and start to see that the medicine, the cannabis, is working for certain types of conditions. It changed me a lot, and this, of course, my fiance was my first patient. Uh, After some time, I published this case with another patient because it's very well documented. He used it with the standard treatment cannabis or CBD and THC, and we documented everything. With two patients in the same age, very close type of tumors. They were grade 3 already because the tumor with the time transformed. I was really nervous, so he was my first patient for many types of reasons. And he lived 5, 6 years more than everybody expected. So it was really incredible, the whole story. This changed my life forever. I wanted to work with medical cannabis. And I was with another doctor, and he came to me and said, listen, you have to understand and go and search for functional medicine because it's exactly what you're looking for, and it's going to answer your questions. And then I went to the United States to study because here in Brazil, we didn't have so much space for that. I went to United States, I went to the Functional Institute of Medicine. I start to study so why we are so sick and why those patients, they come back every time. They were always there because we were not treating them from the root case. And when you treat patients and you understand the physiology, you can really go to the roots, and this has changed everything. So now my practice is very based on functional medicine, and I use a lot of cannabis as a tool for making the symptoms better, and the patient can do the change that is necessary for the healing process. So because I started in 2013 here in Brazil, in 2014, we were able to prescribe. I already was studying that, so I was one of the first doctors in Brazil to prescribe medical cannabis. Today, I am one of the pioneers in that field and got a lot of attention because of this pioneerism. I don't know if it's correct to say that.
Yeah, that works.
Okay. So yes, so that's the way I started.
Well, thank you, Paula. So in Brazil right now, tell us a little bit about the cannabis program. Like what patients are eligible, and once they see a doctor like you and have cannabis recommended to them, what products are available or how do they get the cannabis?
Yeah, here we have some limitations, but we already have something, so doctors can prescribe types of the medicines, different in different compositions. In the beginning, we just had CBD, and now we have more than 50 companies with different compositions and THC, CBD, 1 to 1, 20 to 1, 3 to 1. So we have more flexibility. It's still cannabis, THC in a gray area. We have a regulation for it right now that is turning to medications. So we have a limit time now for these companies in Brazil to change the composition to GMP products for pharma grade products to be able to sell in the pharmacy. And our FDA give them at least 3, 4 years to then complete the clinical trials, but the products already are being sold. So because we have cannabis used for so long, for some types of conditions, we don't need to prove anymore. We know that it's working, but for the rules and for the regulatory, we have to have clinical trials for the medications that are selling in the pharmacy. So they have to do it, but they can sell that before the studies be concluded. So now we have companies with products that still come from Canada, United States, and abroad. They don't are pharma grade, but they're gonna become pharma grade if companies organize them for that. And we have two great pharma products in the pharmacy. One is Sativex. In the name of Brazil is Mevatil, is a different name, but it's the same product. Sativex is I think everybody knows what it is a spray or 121 THC CBD for multiple sclerosis. And we have isolated CBD very close to Epidiolex, but here is CBD. And that's two products in the pharma. So you can also prescribe.
So Paula, outside of those two products, when a patient goes to purchase cannabis, is it a specific cannabis dispensary or do they also get that from a regular pharmacy?
Yeah, now we have a different type of law because the companies the companies in Brazil that sell products from abroad, they cannot have anything in stock. They cannot have a place to put that product. So they have to import one to patients. So they just do the transactions. We don't have dispensaries, and flowers of cannabis are not allowed in Brazil. We can just use oil, tinctures, capsules with THC, but we cannot use flowers with THC. It's not allowed to vaporize.
Wow,
Or
so no inhalation.
no inhalation, yeah.
Wow,
So
that's challenging.
it's a very challenge.
And I'm assuming patients are not able to grow their own cannabis under any circumstance.
They can. Now there is another movement coming from the lawyers even. There is a very great movement in Brazil called Reforma. Reforma is reform in English. And there's a group of lawyers and they are helping patients to have approval for the law to be able to plant and grow in their own homes for specific conditions. So now we have more than 100 families in Brazil with this with that. So yeah,
Right.
it's growing. Yeah.
Okay, it's a start. And so when you see a patient and you recommend cannabis to them in a certain way, do you feel like it's fairly reliable for them to be able to meet your requests, to find products that are compatible with your recommendations?
I try my best actually to be very personalized on that, because if I know